Hi Rudi, thank you so much for seeing me today. Before we start on our subjects about Shin Splints, please can you introduce yourself?
Sure. Hi Portia, thank you for asking me to come along and do these questions today. My name's Rudi Chaplin. I'm the owner here at the treatment lab. I'm a sports rehabilitator and have 15 years experience working in sport, professional sport and clinics as well.
Can I go straight into a question? Can I ask you, what is Shin Splints?
Yeah, so Shin Splints is a really common term given to pain anywhere pretty much from knee down to ankle. Most commonly it will be on the medial side, the inside part of the shin, but there are quite a few injuries, like I say, that come under that umbrella term of Shin Splints. You can get stress fractures, which is obviously one you've got to be really careful of. It is a high risk injury with running and requires absolute rest, so if you're ever unsure, get it checked out. There's compartment syndrome, which is to do with the muscles and the different tissue compartments within the lower leg. And there's tibial stress syndrome, which is an irritation where the muscle attaches onto the bone as well. So yeah, there's a few sort of different things that can be classed as shin splints. More commonly, it will be pain along the inside and occasionally onto the outside. But it is always best to get it checked by a professional, because if it's shin splints, it needs rest. If it's the other ones, you can work on it a little bit.
What are the common causes for shin splints and how can you avoid it?
The common causes, well, running is one of them. It's high impact, and if your muscles aren't adapted enough, if there isn't enough tolerance of the muscles in the lower leg, they get irritated, and that can lead to further bone damage as well. So more often than not, it will perhaps be doing too much too soon. So if you go from complete beginner to running lots, the muscles don't have time to adapt, the bones don't have time to adapt and get stronger, and everything will sort of have its breaking point. So it's very important to try and do a gradual increase. The 10% rule is a really good one to stick to, so don't increase your weekly mileage by more than 10% a week to make sure that the tissue has a chance to adapt and get stronger. Other things that are quite important is the biomechanics. So if you have something going on with your foot, maybe you pronate a little bit too much, or there's something not quite right and there's a bit of an imbalance there, it's best to get your gait analysis done. So go along to a running shop, get them to have a look and get the right trainer for you, because you need a good supportive trainer if you do pronate. You could also see a podiatrist as well to look at your foot alignment. But you need some cushioning, so your trainers should also be replaced quite regularly. It depends on the trainer, but between 400 and 500 miles they should be replaced. If they're not, they lose their cushioning and the shock goes up the leg and causes issues as well.
What stretches do you recommend?
Okay, so more often than not, so if we're talking about the inside of the shin, quite often it's tight calves, it's tight through the foot and ankle, so there's a few exercises we can do for that. So first one is working through your calves. There's two stretches to do. First one, we'll get into gastrocnemius, the main calf muscle. You'll have a straight leg behind you, you lean into the wall and you should feel the stretch into this part here. Each time you stretch, you want to hold for about 10 seconds and repeat 2 or 3 times. And then you're going to get into your soleus muscle. So this one you want a bent knee as well. So you'll feel the stretch a little bit lower down towards the Achilles and a lot lower down into the calf. On top of that, in terms of working on the muscles, it's also important to foam roll. 2 or 3 times a week you want to be foam rolling. With that you want to make sure that you're sort of getting plenty of pressure through the calf, and you just gently roll, and it's a bit of self-massage to help release the fascia and the muscles through the lower leg. 2 or 3 minutes on your calves is probably enough to do, and you can obviously work on other body parts as well. Pretty much hip down is a good thing for a runner to do. Another one that's really important for shin pain is to loosen the bottom of the foot and the ankle. So with this, using a spiky massage ball, you can roll through the foot from heel to toe and then side to side. This releases the plantar fascia, it releases the foot and ankle and all of the joints through there, and this will help take a lot of the strain from running. So you need to have some good tissue adaptability through there. It needs to be nice and loose. If you have a really stiff foot and ankle, it puts more shock up into the shin. So along with that, other things like massage as well can help.
Right. So Rudi, what are your 3 tips for our runners?
Warm up, always have a warm-up. Don't go straight into a session, especially if it's interval stuff. You're risking injury, so make sure you have a good dynamic warm-up, lots of stretches with that. Making sure you work on strength. Leg strength and core strength is really important. Not only will it make you a more efficient runner, it will make you less prone to injury as well. And get your legs worked on. If you're training regularly, if you're building up towards a big event, get a sports massage to help release those muscles.
Fantastic. Thank you so much, Rudi, for talking to us.
No problem. Thank you.